ادعمونا بلايك للفيديو واشتراك بالقناة فهذا يدعمنا كثيرا.
Endodontic access openings are based on the anatomy and morphology of each individual tooth group. In this video, you're going to learn how to make access preparations for various teeth. Maxillary incisors. The maxillary central incisor has one root and one canal. In young individuals, prominent pulp horns are present, requiring a triangular outline form. As the pulp horns recede, the outline form becomes ovoid. The initial penetration into enamel is made with a number 2 or number 4 round burr perpendicular to the lingual surface of the tooth. This outline form is made in the middle third of the lingual surface. After penetration to a depth of 2 to 3 millimeters, the burr is reoriented to coincide with the long axis of the tooth. The canal is located by using a sharp endodontic explorer. The roof of the pulp chamber is removed using a number 2 or 4 round burr. Check for the presence of pulp horns with a curved endodontic explorer. If present, remove it with a small round burr. To establish a direct line access to the apical foramen, the lingual shelf is removed using a tapered diamond burr. Failure to remove the lingual shelf will result in inadequate access to the entire root canal system. A large diamond burr is used to refine the outline of the access. A barbed brooch is placed inside the canal to remove the pulp. The canal is irrigated with sodium hypochlorite. A piezo drill is used to establish a straighter line access. The access cavity in this tooth has a triangular outline form. A completely cleaned and shaped canal is observed under an operating microscope. Inadequate access cavity in these teeth prevents complete cleaning and shaping of the root canal and causes discoloration because of the presence of unexposed pulp horns. Access cavity preparation for the maxillary lateral incisor is similar to that of the central incisor. Depending on the patient's age, it can have a triangular or ovoid outline form. Maxillary canines. Maxillary canines have one canal in a single root. Generally, pulp horn is absent, so the outline form for this tooth is ovoid in the middle third of the lingual surface. Here we have an intact maxillary canine with a large periapical lesion surrounding the adjacent teeth. To rule out lesions of non-pulpal origin, a test cavity is performed without local anesthetic. Like central and lateral incisors, after penetration to a depth of 2 to 3 millimeters with a round burr, the burr is reoriented to be parallel with the long axis of the tooth. After locating the canal, the roof of the pulp chamber and the lingual shelf are removed by a number 2 round burr and a tapered diamond burr. This action establishes a direct line access. The pulp was necrotic and the patient did not feel any pain during this procedure. Root canal treatment was performed for the patient. Maxillary premolars. The outline form for the maxillary first and second premolars is similar. When 2 canals are present, the canal orifices are located under the buccal and lingual cusp tips, equal distance from a line drawn through the center of the chamber in a mesial to distal direction. The initial penetration is made with a number 2 or number 4 round burr in the center of the crown and parallel with the long axis of the tooth. The pulp chamber is located by using a sharp endodontic explorer. The roof of the pulp chamber is removed completely using a combination of a number 2 or 4 round burr and tapered diamond burr. A similar outline is prepared for the tooth with a composite restoration. After locating the pulp chamber, the roof of the pulp chamber is removed by a number 2 round burr. To establish a direct line access to the apical foramen of each root, the access is extended by a tapered diamond burr. The canals are now ready for cleaning and shaping. After following the same protocol, similar access outline is observed in a premolar with full crown coverage. Maxillary molars. The outline form for the maxillary first and second molar is very similar. It is triangular and located in the mesial half of the tooth with the base to the facial and the apex towards the lingual. The mesiobuccal canal orifice is located under the mesiobuccal cusp tip. The distobuccal canal orifice is found under the distal cusp and slightly lingual to the main mesiobuccal canal. The palatal canal orifice usually lies under the mesiolingual cusp tip. The orifice of the mesiolingual canal is located 1 to 3 mm lingual to the main mesiobuccal canal. It is slightly mesial to a line drawn from the mesiobuccal to the palatal canal. The access preparation into enamel is made with a number 4 or number 6 round burr in the center of the crown and parallel with the long axis of the tooth. The pulp chamber is located by using an endodontic explorer. After giving an intrapulpal injection, the roof of the pulp chamber is removed completely using a number 4 or 6 round burr with an in and out motion. A large diamond burr is used to modify the access preparation and establish a direct line access to the orifice of each canal. A large pulp stone is found on the floor of the pulp chamber of this tooth. With the use of a spoon excavator or an endodontic explorer, the pulp stone is removed. The pulp chamber is irrigated with sodium hypochlorite and the pulps are removed using barbed broaches. The coronal portion of each canal is flared with rotary instruments to establish straight line access to each root. Sodium hypochlorite is used to remove the generated debris. Gates Glidden burrs are used to establish straighter line access to each canal. The canals are now ready for cleaning and shaping. After following the same protocol, similar access outline is observed in a maxillary molar with full crown coverage. Mandibular incisors. The mandibular incisors are narrow in the mesiodistal dimension and broad faciolingually. They may have 1 or 2 canals. In young patients, the outline form is triangular with the base incisally and the apex gingivally. As the pulp recedes over time and the pulp horns disappear, the shape becomes more ovoid. In cases of attrition, the axis is extended towards the incisal edge. The initial outline form is established into the dentin and in the middle third of the lingual surface with a number 1 or number 2 round burr perpendicular to the lingual surface. When a depth of 2 to 3 mm is reached, the orientation of the burr is changed to be parallel with the long axis of the tooth. The pulp chamber is located by using a sharp endodontic explorer. The roof of the pulp chamber is removed completely using a number 2 round burr with an in and out motion. To establish a direct line access to the canal or canals and find a second canal, the axis is extended lingually using a tapered diamond burr. The lingual surface of the axis is explored for the presence of a lingual canal. The canal is now ready for cleaning and shaping. Mandibular canines. The outline form for the access to the mandibular canine is very similar to that of the maxillary canine. The outline form is ovoid. In cases of attrition, the axis is extended towards the incisal edge. This tooth can have 1 or 2 canals or roots. Like maxillary canine, after penetration to a depth of 2 to 3 mm with a round burr, the burr is reoriented to coincide with the lingual orientation of the root and be parallel with the long axis of the tooth. After locating the canal, the roof of the pulp chamber and the lingual shelf are removed by a number 2 round burr and a tapered diamond burr. This action establishes a direct line access. An endodontic explorer is used to check for the presence of a pulp horn. If present, it should be removed with a small round burr. The lingual surface is explored for the presence of a lingual canal. The canal is now ready for cleaning and shaping. Mandibular premolars. The mandibular premolars can have 1, 2, or 3 roots. The axis is ovoid in a buccal lingual dimension and positioned buccal to the central groove. The initial penetration into enamel is made with a number 2 or number 4 round burr in the center of the crown and parallel with the long axis of the tooth. The pulp chamber is located by using a sharp endodontic explorer. To establish a direct line access to the apical foramen of each root and find extra canal or canals, the axis is extended buccolingually. After establishing the working length, the canal is prepared with the use of rotary instruments. A completely cleaned and shaped canal is observed under an operating microscope. A similar outline is observed for a second premolar, which developed irreversible pulpitis after being prepared for a gold crown. Mandibular molars. The mandibular molars usually have 2 canals in the mesial root and 1 canal in the distal root. The mesiobuccal canal orifice is located under the mesiobuccal cusp tip. The mesiolingual canal orifice is located near the central groove and is slightly distal when compared to the mesiobuccal canal. 30 to 35% of these teeth have a second canal in the distal root. The distal canal is located near the intersection of the buccal, lingual, and central grooves. When a distobuccal canal is present, the orifice can be found buccal to the main distal canal and is often slightly more mesial. The access preparation is made with a number 4 or 6 round burr in the center of the crown and parallel with the long axis of the tooth. The pulp chamber is located by using an endodontic explorer. The roof of the pulp chamber is removed completely using a number 6 round burr with an in and out motion. To establish a direct line access to the apical foramen of each root and find extra distal canal, the axis is extended buccolingually and mesiodistally using a large diamond burr. The coronal portion of each canal is flared with rotary instruments and debris are removed with sodium hypochlorite irrigation. The canals are now ready for cleaning and shaping.